Good afternoon, everyone. Thank you so much for joining us. I'm joined today with Bob Cowell, our city manager, Mayor Lee, and Vice Mayor Joe Cobb. So I'm going to turn it over to Bob first.
Sure, thank you. First I'll start, I said I get to share the bad news, I guess. So I'll start with the fact that we had anticipated having Dr. Kirkering with the Virginia Department of Health and the Virginia Tech Carilion School of Medicine joining us at the end of this so that he could talk a bit further on what I know he shared with most, if not all of you, at his event yesterday. And unfortunately, about noon today, he let us know that he had to go to Richmond for an event that he had to be at as well. So he will not be joining us. We're certainly still able to our limited degree respond to the kinds of questions that you might have had based off of information that he shared yesterday, but just want to let you all know that up front. And so as a result of that, our comments will be relatively short and then take any questions. Today is going to be focused obviously on updating you on our COVID response and our current and planned reopening. So the questions that we will take and discuss will be those limited to COVID and the response and the recovery. So with that introduction, I'm going to turn it over to Mayor Lee. And so, Mayor, if you wouldn't mind getting us started.
Thank you, Bob and Tiffany and Joe. Good afternoon, everybody. First, I want to thank those who continue to practice physical distancing and the wearing of face masks. This is so important to the health of our community because the virus is still present here. And please we want to make sure all of our citizens remember that. In fact, across the state, we are actually seeing an increase in the number of cases. Our challenge is to continue to remain vigilant against the virus while we work to reopen our economy. The municipal building reopened to the general public on Monday for limited services in the Treasurer's office and the Commissioner of Revenue's office. And this has gone well. And citizens can learn more about accessing these services by viewing a video on our website at roanokeva.gov/StarCityStrong. And more reopenings are on the way. The city is currently accepting applications for the Summer Play Enrichment Program. Our Summer Feed and Read program will begin operating curbside next week. And on July 1st, DMV services will be available in the Treasurer's office. And on July 6th, we will have a more complete reopening of our facilities. More details about these plans are available on our website, again at roanokeva.gov/StarCityStrong. The city will continue to open in limited phases. And again, I want to stress the need to take proper precautions when you are in a public building because we are still seeing an increase in cases here locally. And so that's important that everybody grasp that message. There's still a virus out there and we're seeing an increase. Many of our shops and restaurants are reopening as well. And we hope you will take some time to visit them just to be aware that the importance of taking the appropriate precautions when you do. And I can't say that enough. Please be cautious, take all of the necessary precautions as we've outlined today and we'll be continuing to outline as we go forward. Now this time I'm pleased to bring forth our Vice Mayor, Mr. Joe Cobb.
Thank you, Mayor. As the Mayor mentioned, it's important to support our local economy, but we must not lapse into quarantine fatigue and forget the precautions that need to be taken. Physical distancing, wearing of masks when indoors or unable to maintain separation, washing of hands, and staying home when ill. As restrictions are lifted and more folks venture out and about in our community, There are a couple of tools to assist everyone in keeping safe. The Roanoke Allegheny Health Districts has launched a new social media campaign to encourage people to wear face masks. The campaign is called I've Got You Covered. The goal is to show people that wearing a face covering helps to protect others, not just themselves. To participate, just snap a selfie and post it on Facebook using the hashtag I've Got You Covered. This is a great way to remind people of the importance of wearing a face covering. Visit Virginia's Blue Ridge has initiated Virginia's Blue Ridge Stay Safe Pledge as a commitment to keep each other safe and healthy. The pledge follows recommended guidelines from the CDC and public health officials and helps create an environment of safety while we enjoy the businesses and experiences that make Virginia's Blue Ridge a special place. The pledge is available in a variety of formats and resources that can be used for each business purpose. The Stay Safe Pledge Toolkit can be found at visitroanokeva.com. You can simply download, print, and post it on your door or post it on your website and social media. These are two great examples of ways in which our community is coming together to highlight how we can both support our local businesses and reopen our economy and protect ourselves and others from the virus. Thank you, and I'll turn it back over to you, Bob, and Tiffany.
Thank you, Mayor and Vice Mayor. And again, for those of you that may have joined in the middle of it, unfortunately, we had a kind of last-minute cancellation from Dr. Kirkering, and so we have our remarks are relatively short and light today. I do want to add to what the Mayor and Vice Mayor have mentioned in terms of our reopening and ultimately the economic recovery, and remind everyone that, of course, on this past Monday, or last Monday, sorry, the council established the Star City Strong Recovery Task Force, and that task force is charged with meeting and making recommendations to the council regarding the use of funds that will assist in supporting the community's recovery efforts as we go through. And applications are being taken for that task force through the end of the day tomorrow. So at that point, then we will turn those applications over to the council, and the expectation is at their meeting on the 15th on Monday, they will go ahead and actually make appointments to that task force. And then the task force will basically work for just slightly over or right around a month, basically, and then make their recommendations to the city council. And of course, as we've explained previously, the speed with which we are acting on that is due to some of the funding has a very fast burn rate to it that requires it to be expended by the end of the calendar year. So there's more information on the website that the Mayor and Vice Mayor referenced on our website as well that goes for that as well. The first question that we have is actually from Jean Morano, and Jean is saying that Dr. Odell said yesterday that she personally would not eat inside of a restaurant at this time, and that she has concerns about asymptomatic people out there. And how do we balance that remark by Dr. Odell versus promoting people to go out and eat? And I guess, I think, and certainly, the Mayor and Vice Mayor can join in as well. I think that, to the points that were made earlier, is that it is a balance between both trying to figure out the best way to reopen the economy, as well as trying to protect ourselves and others from the virus, which is very much still active and remaining. And that involves the limited amount of seating that the governor is currently allowing inside restaurants, still the emphasis on takeout and delivery services, the wearing of masks, and a whole host of other precautions. And I think what Dr. Odell is likely referring to is none of those are foolproof. Obviously the virus is there. We all know that. The businesses that are opening know that. The governor knows that. And that's why everyone, including the businesses, are trying to take as cautious and as deliberate a process as they can in reopening. And I think at the end of the day, just as Dr. Odell said, it really comes down to a personal choice as to how you choose to actually balance that access to economic goods and protecting you and your family's health as well. So I don't know, Vice Mayor or Mayor, if you have anything you want to add to that question. That's just sort of my thoughts relative. I didn't see the remark or the the information yesterday, but just reacting to that question from Gene.
Well, we want to make sure people are taking all of the necessary precautions. There's been a push from the business community, and the governor has directed businesses to open up with limited seating. And so we're trying to accommodate everyone, but to make sure our citizens are safe. And that's what we get as the governing bodies, a push to do that. And we're urging everyone to make that decision, but if they decide to go into a restaurant or anywhere, take the necessary precautions.
Thank you. And Ralph is asking a question regarding the budget. So I will deviate slightly from what I said at the beginning about staying COVID focused, but because the budget is so COVID impacted, it's certainly a relevant question. And the question coming in from Ralph is that the budget is scheduled to be adopted on Monday, and is everything on track, or will there be additional tweaks? At this point, the way that the budgeting system works here, we have to have a budget adopted before the end of this fiscal year, which ends in June. And so we have concluded all of the steps that allow any further adjustments with the budget. Those came in the form of the public hearing, as well as the budget study that was accomplished. So no, at this point, the budget has to be approved as presented. And then, of course, one of the things we've all been sharing as we've gone through this budgeting process is there is so much uncertainty associated with FY21 that we will be actually monitoring and reporting to the council every month on the performance of the budget, because it may very well have to adjust or switch as we go forward into the budget year because of the way in which revenue is performing. So right now, that's the budget that will go forward, and then the question just will become what kind of adjustments become necessary. The next question is coming in related to, not surprisingly, given the governor's announcement yesterday, what our thoughts might be on the governor's plan to reopen schools this fall. And then I would add to that kind of the phased reopening portion of it. And I'll preface this and then turn it over to the mayor. I'll preface this by saying that obviously, as the governor has indicated, there is much more that needs to be developed in that plan. And I believe, actually right now, I believe there is a phone conference going on among the school leaders and the governor's office. And then tomorrow, I think the governor is supposed to put out some additional information as well. So Mayor, you want to talk a little bit about your thoughts relative to the little bit that we do know regarding the reopening of the schools come fall?
Well, as you said, it's going to be a phased opening. It's pretty much going to go as we have worked with the reopening of the economy. And it's so important. I am really pleased to see that there are a lot of committees working on that, but we want to think seriously about how we're going to do that. It's going to be challenging. It's going to be a challenge this fall, and there are a lot of discussions going around about maybe kids going back 1 or 2 days a week. Everybody is still doing some virtual work. Technology is going to be a big role in that. I am hoping and praying that it can all work out. I know a lot of students and teachers are anxiously waiting to get back to work, but we have to make sure, and I'm sure our school board is preparing to discuss this in detail, and we'll be there to support them as we always have been. And I'm looking forward to our new superintendent coming in to render her thoughts and ideas on how we go forward. So it's a new normal out there. And so we'll be there and we'll be in place to assist and help our school administration, school board, and others as we go forward.
Thank you, Mayor. And just so everybody knows that the vice mayor had to leave us. He's actually working his way back to Roanoke and is in an airport, and I presume right now is catching his plane. So just want to let you know why he sort of disappeared. Luann had asked the question regarding if there is anything that the city can do relative to the lack of wearing of face covers in businesses or allowing too many people in their establishment. And the enforcement mechanism that has been laid out by the governor's office is actually one in which is enforced by the Department of Health, not by localities. And he made it very clear that it will be in the form of education. And so there is, VDH has put out a number, a hotline that they ask folks to call if they see those violations. They ask that the local offices not be called, because those offices are actually out there handling testing and dealing with the cases and those types of things. But that's the mechanism that's used. Shane has asked about the budget and the fact that it's likely to cause the response to COVID and the phased reopening and so on are likely to cause increases in the funding school budget, just as it has. He didn't put the, I'll add this part, just as it has for us in the city as well as for practically every business out there. And due to those increased costs, do we anticipate providing additional funding for the schools? Of course, I think you all know that the school funding here is based upon a formula that's agreed upon, and that is how we structure the formula or structure the funding of the schools. The schools did actually receive direct funding, as have we, from the state to help offset some of those costs, and I know they're using those costs. That recovery fund that I mentioned earlier, there are certainly options in using some of those funds possibly to support some additional efforts with the schools if that becomes necessary. So short answer is the schools have received additional funds to address that. Longer answer is there may be some, but it would not be through general fund dollars. It might be through some of the CARES funding that we have received as well. Jean is asking about school buses and whether or not issues with those may force more online classes. And Jean, unfortunately, I'm going to have to deflect that one to really to the school. I don't know the answer to that, and that would be something to ask the officials at the school. Good question. I don't know the answer to that. And then the next question is coming from Luann, and it deals with the comments, and this was part of why we had hoped to have Dr. Kirkering on so he could explain this a bit further. But Dr. Odell and Dr. Kirkering yesterday talked about the virus affecting, in particular, the Hispanic residents of our community. And I think the numbers are somewhere around 23, 25% of our cases here locally assigned to Hispanic residents when they represent about 7% or so of our population. And so what role can the city play in reducing this spread? And that's a great question. And the role we are playing is we are assisting the health department in identifying ways in which they can provide some targeted kind of testing. So for example, in the past, you know that the health department has gone into nursing homes, for example, where there has been an outbreak and target their testing. And in this instance, they're trying to find ways in which to enter into areas that may benefit the Hispanic population. And we're offering and providing logistics support with that. We're also working to assist them in, and have been working with them in spreading the word about the precautions that the mayor referred to and the need to address those, and trying to get that word out in Spanish as well as in English, and assisting them with that and making those connections. And we'll continue to do that as we move forward. Most of those cases, I think they referred to this at their hearing, at the meeting they had yesterday, most of those are directly related to a couple of outbreaks. And so they kind of know where and why they're spreading, but they really are trying hard to get the word out in as many different ways to the population to be able to prepare themselves to keep themselves safe as they go forward. And that is an issue that has within the last couple of weeks arisen that I know they're putting a greater emphasis on. And again, we're certainly prepared and have been helping them and trying to address that as we go forward. And I know yesterday they implored kind of you all as well to help spread the word as much as you're able to. And I think actually the Roanoke Times recently did do something in Spanish to try to help get that information out to that population, that part of our population. So thank you, good question.
And WDBJ, I know, does a newscast that's in Spanish, and then we've reached out to a lot of our partners to try to push some messaging out there as well.
Great, thank you. Well, I don't see any other questions, and again, I apologize that we had a little bit limited amount of information today, anticipating having someone else on that we were unable to do so. certainly hope to keep you all informed as well. There is a good possibility that in light of kind of the pace now at which things are occurring, that this press conference will not occur next week. Next Wednesday, we'll pick it up the following Wednesday. Obviously, if something that warrants us changing that and continuing the schedule, we will do so. But right now, the plan is we will not do this next Wednesday. It'll be the following Wednesday that we'll pick this back up again as well. So I appreciate it, and thank you all very much. Thank you, Mayor. Well, I guess I should give you the chance to say any last words you would like to have.
Well, thank you all. And I just want to emphasize what we've been talking about at this conference is precaution is the word of the day. We're continuing to phase in our openings, but restaurants or wherever you're going, please take the necessary precautions. And I think some people may have gathered from the events that have been occurring in the last 2 weeks with the protests and the public gatherings that things may be back to normal. It's really not. And we're in a area now that some of our medical professionals are concerned. So please take the necessary precautions as you go to and fro. Thank you. Thank you, Bob.
Thank you, Mayor. Thank you all.
And we'll see you guys in 2 weeks, and we'll make sure to get that information out to you. Okay, have a good one.
Thank you.